Welcome back to Healthcare Now. This is Larry with Dr. Mark, and we have a guest on the show, Dr. Angela Mazza, who actually came on the show a couple weeks ago. She is an endocrinologist with the Metabolic Center over in Oviedo, and Metabolic Wellness Center over in Oviedo, and we talked about her practice and some things. But today, by the way, welcome to the show, Dr. Mazza, again.
Thank you.
And we want to talk more about radio frequency ablation today. Dr. Mark, you want to start the questions off?
Yeah. Good afternoon. How are you doing today?
Good, thank you.
Good. Yeah, we did. We got a lot of questions afterwards. We mentioned it last time, but we didn't get into a great detail, and it's such a unique thing, not only in its science, but in its availability. And I don't want to, get ahead of ourselves. I want you to have something to talk about. But if you want to start, if any of the listeners missed you last time, a quick medical background, and then if you can just kind of explain what RFA is.
Sure. I'm an integrative endocrinologist, so that means I am traditionally trained in internal medicine and endocrinology, so I'm double board certified in those fields. But I went on to do some additional training in functional or whole body wellness through the American Academy of Anti-Aging Medicine. I've been caring for people with thyroid nodules for over 15 years, and I am considered a thyroid specialist because I'm certified in neck ultrasound. So it's one of my most favorite things to take care of.
Very cool. Yeah.
Radio frequency ablation has been around for a very long time. It's a minimally invasive technique, and it's used for different tumors and tissues like liver, lung, kidney, prostate. You may have also heard it used for treatments of heart disease and varicose veins. Back in 2002, RFA, however, was first used for the treatment of enlarged benign thyroid nodules out in South Korea, and since then it's been used internationally. One of the benefits of radiofrequency ablation is that it targets the thyroid nodule, and it minimizes any injury to the healthy thyroid tissue. So it's mainly used for benign thyroid nodules or overactive thyroid nodules right now.
So typically, would you start with just a needle biopsy and determine that it's benign, or?
Yes, that's correct. We would do an ultrasound-guided FNA biopsy or fine needle aspiration biopsy to confirm that first.
So what symptoms, Dr. Mazza, would bring you to looking at your patient for radio frequency ablation?
Well, basically, something that's concerning to the patient should be kind of first and foremost, because these are usually used. This technique is usually used for benign thyroid nodules. So if someone sees something in the mirror cosmetically unappealing, if it's causing some compression on airway, trouble breathing, change in voice, or cough, these might be reasons why someone might pursue this procedure. It's really attractive that it's done in the office, so there's really no downtime whatsoever, and it doesn't leave a scar.
Right.
Interesting.
Now, how did you learn about this?
I started hearing about it in publications about 8 years ago. Around the time of 2016, the American Association of Clinical Endocrinologists, or ACE, started noting it in guidelines as, a viable option for people with benign nodules. And it didn't happen until end of 2019 that the FDA approved it. So around that time is when we started working it into our practice.
Gotcha. Okay. Very good. Yeah, because I'm very familiar with RFA and other tumors, and even in some pain control things.
Right.
And so that I knew the technology was there. So if let's look at from the patient's point of view. Quite often they're just having their regular workup, and they might get some labs done by their internal medicine doctor, or they get an ultrasound. At what point do they? Because I would think they need to find you. Right. I mean, at what point did they kind of branch off and say, "Well, I need to go talk to Dr. Mazza because I know there's this other thing"? What do they need? I assume that you get most of the stuff done yourself, but they have to get to you.
Right. That's true. So, I mean, obviously, first the nodule has to be found, but if someone's having symptoms, patients are usually a little more proactive. Oftentimes, I see patients after they've had the biopsy, and they've been told that thyroid surgery is their only option.
Right.
So, and these are the people that want to preserve their thyroid function. So, a lot of times there's different Facebook groups and people are very proactive, like I said, and then they kind of start searching out where they can get this procedure done.
Well, as a layman, Dr. Mazza, what does the RFA actually do to the nodule? Can you explain to our listeners a little bit? Because we may have some people out there that are saying, hey, I've got that problem.
Mm-hmm.
Let me understand what this really does.
Yeah, so RFA, from a technical standpoint, involves kind of introducing an electric current into the tissue. So the tissue gets agitated and causes friction, and that produces heat. And the tissue in the vicinity of the electrode actually becomes ablated and starts shrinking down.
Okay.
Now, what do they feel when this is going on?
Well, they usually don't feel anything at all,
Mm-hmm.
because we give a lot of numbing medicine.
Gotcha.
But the most common feeling that people have during the procedure itself is a little bit of popping, because that's the thyroid tissue being ablated.
And so they see an instant, if they have something that they can see in the mirror or they can feel, I imagine there's some edema, but they get kind of an immediate result with this?
Yes. Patients
Wow.
are really surprised about how quickly they start noticing improvements in the mirror, notice symptoms, and if they've had tightness in their neck or voice changes. The studies do show at about 6 months, 60 to 90% improvement, and then at 1 year, 80 to 90% improvement in the
Well,
size
let me
of the
ask you
nodule.
this. If patients have these enlarged thyroid nodules and they don't get it taken care of, what could that end up being? Are we talking thyroid cancer?
Well, the chance of thyroid cancer in these growing nodules is low.
Okay.
And if any, it's micropapillary, very, very small. But sometimes these nodules continue to just grow, and they continue to cause worsening of the symptoms, whether it's cosmetic or swallowing, and they just continue to grow, requiring more and more thyroid biopsies as this happens.
Right. I can imagine, because I know, I do thyroid surgery, and
Right.
if we get a biopsy and it's benign, we're like, okay, well, we'll see you again in 6 months or a year. And I don't have to worry about it anymore, but they do. So
Right.
this does give them a totally different option because we're sort of balancing the risk of surgery. That's a big deal. So we wouldn't want to take out a benign thing unless it was really causing problems. But this seems like a great area of people that don't. They're like, I don't have anything I can do, but this is actually something relatively new with a well-known technology.
Well, you bring up something very interesting, Dr. Mark. You said you do thyroid surgery.
Mm-hmm.
Is this RFA available for children or just adults? Dr. Mazza?
Oh, Dr. Sorry, I said Dr. Mark.
I don't know.
No, not to the best of my knowledge at this point. It's tough for things to be cleared for the pediatric population unless it's been around for the adult population for a while.
I'll tell you a little secret that I learned a lot of years ago, because I do a lot of laparoscopic surgery and a lot of fun stuff like sounds you get into, and absolutely nothing is cleared for pediatrics. And when I've had companies talk about, well, we're going to go get a pediatric indication, I tell you, they spend a lot of money to learn that it ain't going to happen. However, we use this, like I can see this being done for kids in many situations. Right. If that's the standard, it's the standard. I mean, and we don't see too many kids under 15 that have significant sized nodules that aren't cancer. So I think that keep your eyes open. I would say when people in your society, other folks in other cities that are doing this, you're going to get some folks that, I saw an 18-year-old, a 17-year-old. It'll keep working its way down, but it'll never be officially approved. So.
Right. And you mentioned, Dr. Mazza, the patient itself. Can you share a couple of quick patient experiences with this procedure?
Sure. I have a couple of young ladies who they had significant thyroid nodules, and it was just causing them great distress, requiring, again, the repeat biopsy again and again. We performed the procedure, and we see improvement almost within a month. And they just continue to have to improve over 6 months and a year. I've had a couple patients who had severe hoarseness or changes in their voice that virtually disappeared within a month.
Wow.
And are there multiple sessions, or is that a one and done treatment? How does that work?
It depends. It depends upon the size of the nodule to start with.
Makes sense.
Because we usually generally only do a session of about 20 minutes at a time.
Mm-hmm.
And if you have a very larger nodule, like 6 centimeters, it's going to take a longer number of sessions than something
and that's big.
only about 2 centimeters.
Again, for our listeners, a 6 centimeter nodule, you're going to notice from across the room. So I'd imagine that
Wow.
takes a little extra work.
Well,
for sure.
let me ask you this. I understand right now you're the only endocrinologist doing RFA in the Orlando market. Is that true?
That's correct.
So our patients can reach you in your Oviedo office at 407-542-0661. Is that correct?
That's correct.
And the website, Dr. Mazza, could you tell us that real quick?
Sure. It's metaboliccenterforwellness.com.
Okay, perfect.
And I would imagine that you'd love it if they come in with no information and just a bump, or if they have information, make sure they bring it to you so you don't have to spend too much time chasing it down. And
the more information, the better.
Yeah.
The more information, the better, because we even have patients calling from out of town who don't want to travel from far off place, like in middle of the country. So they send me the ultrasound, the pathology reports. We do a telehealth visit. So the more information I have ahead of time, the better.
So
people
you're
make
the
like
only
a little
one.
vacation out of it too.
Yeah, exactly.
So you're the only one doing it within quite a distance of the Orlando market, then.
That's correct.
Wow.
Excellent. That is
very
fantastic.
good, yeah.
Well, I tell you, we were really fortunate to have had you back, and I hope we covered things that our listeners understand and they know how to find you. But thank you so much for spending more time with us.
Oh, thank you so much. I appreciate it. I appreciate
We have enjoyed talking with you twice now.
Absolutely. All right. Well, we're gonna go to break, but if you have any other questions, you can get us through our site as well, and we'll direct you to Dr. Mazza.
Yep.
Thanks again. Have a wonderful day.
Thanks
Thank
so
you,
much.
Dr.
Bye-bye.
Mazza. Okay.